Is there such a thing as the terrible twos? What are 2-year-olds really like?
There certainly are things that people call the terrible twos, but they're really not terrible. They're just a challenge for parents to deal with. They really are an expression of a 2-year-old's independence, a desire to sort of move out on his or her own, to develop a little of their own agenda and explore. Exploration and invention is what 2-year-olds are all about. The issue is keep them under some closer watch and not react to their need to go and exert their own independence. It's really a good thing. It just means it's a challenge to deal with as a parent. But view it as a positive part of their growth and one that you have to respond to in a positive way and not get overly critical or negative.
What kinds of things can 2-year-olds do with their arms, feet, fingers, and toes? What are the best activities for parents to provide their 2-year-olds?
2-year-olds are really getting around very rapidly. So the key is keeping an eye on them, but providing them the kinds of opportunities that they can test themselves. They can go upstairs and downstairs. They can throw. They can kick. They can manipulate things, and they love to manipulate things. They can do puzzles, simple puzzles, and those kinds of things work for kids. So things that they can create, whether it's pots or pans or sandbox things, if you're a summertime, all work to allow a 2-year-old to express themselves in a mechanical, using their muscles, both fine motor, that's the hands and the small fingers, and also the big motors, the running and the kicking. They'll just love to race around, whether it's in the house or outside. And the more you can do to give them the opportunities to do that, the more fun it'll be for them and the more exercise it'll be. They may be a handful to watch as they move around, but all that's part of the 2-year-old running type of behavior, which is perfectly normal.
What language abilities do 2-year-olds have?
The amount of growth in language in that third year of life, between the second and third year birthdays, are huge. At the beginning, at their second birthday, they can have 2-word sentences. They certainly understand what adults say to them, and they can speak back clearly in understandable language. By the end of that second year, in other words, the third birthday, they can speak very clearly. 3 to 5-word sentences are very common. They'll use pronouns and nouns correctly. They'll identify pictures. They'll be able to identify people. They'll speak in grammatically correct sentences, though short. You'll also start to read to them in a very active way, and they'll repeat back to you certain words. You'll see them model some of your language, so be careful about using language you don't want to hear come back at you through them. But it's a wonderful age, huge amounts of language growth, and fun to hear them get better as the years go on.
Developmentally, what kind of things do 2-year-olds think about?
2-year-olds are also in a certain degree of fantasy and have some fears as part of the 2-year-old time. They're thinking both egocentrically. Most of the time, they're thinking about what's good for me as the 2-year-old. And that's a typical behavior. They're not being selfish. It's just that their world is looked upon from their own vantage point, them as the person. They don't play all that well with other kids because they're playing really sort of in parallel play, and that's perfectly normal. They may also be very concrete in their thinking, and so it's important to remember that some of the things you say that may be a little more abstract, they're not going to think abstractly yet, but they will over time. They're social beings, and that's an important part of who they are too, as they begin to engage their playmates.
How social are 2-year-olds, and when should we be concerned about their negative reactions or behavior?
It's important to remember that 2-year-olds may appear negative with their tantrums at times and their independence as they voice their opinions about things. But it's not really negative. It's just more assertive of their own independence. But they are not great interactive players yet. They tend to play by themselves. They may want things that other kids have, and that's all just part of their egocentricity of who 2-year-olds really are all about. But that doesn't mean they shouldn't be engaging other kids. And they'll come and go. They'll come in and go out with their friends. They'll play with toys together sometimes, and then they'll mostly play by themselves. But play groups, kids in preschool type groups are a perfectly great time for 2-year-olds to start at least to socialize. Though don't be surprised if they don't necessarily play all that well all the time. They will gradually get there, and by the third birthday, they begin to interact much more effectively and positively with their playmates.
What are the do's and don'ts of disciplining 2-year-olds? And what are the best ways to deal with temper tantrums?
The most important thing is that realize that 2-year-olds are independent little creatures. They're wonderful, but at the same time, they are voicing their opinions about everything. And their egocentricity sometimes says, I want to do it my way. And sometimes that's okay, where choices are okay, but sometimes it's not. So the key is not put them in situations where they could explode and wouldn't be embarrassing or put you in difficulty. So prevention is part of it. But when they do have an outburst or they're out of control or do things that are not allowed, then putting them by themselves a little bit, we call them timeouts, does work very nicely with 2-year-olds. Usually a minute per year, so 2 or 3 minutes for a 2-year-old is plenty of time for them to get the idea this is really not acceptable. And as a result, the parents should understand that and then put them into other settings where that behavior is okay and it's not going to get out of control.
Autism is in the news a lot. What signs of autism should parents be aware of at the age of 2?
By the time a child is 2, it is important to be aware of the signs and symptoms of autism. Unfortunately, we are seeing an increased number of children with that diagnosis, and often we see early signs by age 2. There are screening devices that actually your pediatrician may give you. But what you're looking for is either a marked change in behavior, a withdrawal, a slowdown in their language development or a withdrawal of some of their language development, difficulty interacting or getting along with peers, not looking kids or adults in the face but looking off to the side, being somewhat removed or detached or having kinds of movements that are repetitive, whether it's their hands or other things that they're moving quickly or rapidly, twirling of any kind. Those are the things that would indicate that there's something amiss and that they often would reflect autistic behavior and needs to be brought to the attention of your pediatrician.
What should 2-year-olds eat?
The appetite of a 2-year-old is changing and ever-changing. Some days they'll like some things a lot, whether it's peanut butter and jelly or certain cereals, and then the next day they won't want that, just like the new day has dawned. So it's important to be flexible in your choices, but vegetables, fruits, cereals, breads of different kinds, all fine. This is still an age where snacks are a good thing, and healthy snacks are what we're talking about, whether it's celery or carrots or fruit or things like that are important to do. By 2, they're starting to have regular meals, so you want to be sure that you encourage them sitting at a high chair or a booster seat so that they're sort of sitting with you. They're going to be sloppy. Don't expect that it's going to be a clean process. But you're joining them or they're joining you in a meal on a regular basis is a good thing to do by about age 2. Just don't expect great behavior. But the foods can be very varied and nutritious, starting with breakfast, lunch, a snack usually mid-afternoon, maybe a little snack in the morning as well, and then a dinner time as well. They're pretty much off bottles or not breastfeeding by any chance during that period of time either.
Is preparing for toilet training at age 2 too early to start?
Every child is different with respect to toilet training. Some kids are really ready to clearly be toilet trained early on in their second year. Others are really not so ready. If you look at the mean age, it's probably anywhere from 28 to 33 months of age, which is when they really are ready. But as I said, some kids are ready. If they are ready, you'll see that. They'll talk about that. They'll actually be dry during the day, or they'll tell you that, they're having a bowel movement or urinating. When that's the case, it's not too early, and in which case the way to do that is to introduce them to a potty seat, which is a little low-down child toilet thing, show it to them, do it while they're on with a diaper at first, and then gradually get them used to understanding what eliminating in a potty is all about. But that chances are that won't be till later in their second year, in their early part of their third year.
My 2-year-old's still in a crib. When's the best time to move him to a bed?
2-year-olds often start their second birthday still sleeping in a crib, and that's perfectly normal. But cribs, you'll see, for 2-year-olds start to get a little tight, and they'll want to come out more than be in it. So it is the time to start thinking about transition from a crib to a toddler bed or a youth bed, as it's called, in which case it's a time to try that in their second year. One of the ways to do that is get a little youth bed, toddler bed. If it can be next to your bed, that's great, but chances are it will be in their own bedroom, so they should get used to sleeping by themselves, which they have in a crib. It may have a railing. It's a good idea to have a railing. Have it have walls on 2 sides, so there's no falling out as much as it would be if it were all by itself. But a railing is a good idea. You also should be prepared that they'll come to your bed periodically, and you need to sort of escort them back. That's part of getting used to sleeping in a big boy's or big girl's bed. But now's the time of their lives to begin to start to do that.
What immunizations should a 2-year-old have already had, and what more should we expect coming up in the future?
By age 2, they will have had all of their basic primary shots, or immunizations as we call them. That means that they've had immunizations against the pneumococcus, about the Haemophilus influenza, diphtheria, tetanus, whooping cough or pertussis. Hepatitis A is also given at around age 2, polio vaccine, and varicella or chickenpox vaccine, and the hepatitis B vaccine, which is given right at birth and those months right thereafter. So there usually are no need for booster shots or anything else at around age 2, unless they're getting their hepatitis A, which are often given at age 2. Then there's a couple of years of no immunizations needed till they're age 4 to 6, when they'll get some booster shots for those first series of shots that they got. That'll get them ready for school and get them ready for exposure should they come in contact with somebody who might have any of those illnesses.
What are the most important safety concerns for parents?
The 2-year-old time is a wonderful time, but it's also a tricky time when it comes to children getting themselves in danger. Their normal desire to go and explore and see what's under covers and behind doors and things like that is perfectly normal, except they don't know what's behind them. So you have to make sure there's nothing dangerous to them. Kitchens are still very dangerous to children. That means pots and pans are fine under the sink, but nothing more dangerous than that. Poisons or any other things, because poisonings are very real risk for kids who are 2. Stoves, ovens, all those kitchen appliances can really still be dangerous. So, you want to keep knobs off of ovens and put burners on only in the back if you can, and pots and pans, if they're being cooked, use the back burner or turn the handle around. Bathrooms are also a problem. Unfortunately, 2-year-olds are curious and they may put their heads down into toilet bowls, and there have been drownings of kids like this. So keep the bathrooms closed, or sometimes put a little easy lock on the lid of the toilet. Outside's equally dangerous, unfortunately, so garages need to be kept clean of things that could have the child get into harm's way. Driveways, streets, running into streets is a very huge issue, and you want to be sure that your child understands that and you've kept them protected. And when they're riding in a car, they're always in an appropriate certified car seat. By this age, they can ride looking forward in the rear seat, not in the front seat. Children don't belong in the front seat because airbags, which are good for adults, are not good for kids. They can hurt them badly. So center of the back seat in an appropriate car seat with a 5-point harness is the most safest way to do that.
Where can I get more information about Winthrop and pediatric care for 2-year-olds?
There are many places to get information, but be careful of some websites are really not really as reputable as they should be. But a really great one for children and healthcare is the American Academy of Pediatrics website, aap.org. That gives you all patient information about every sort of illness, including much of the material we talked about today. If you need more information locally, we'd be happy to provide that. You can reach us at 1-866-WINTHROP or visit us online at winthrop.org.